For those of you guys who don't know me, my name is JJ Allen. I'm the owner and pharmacist of Sawyer Street Hometown Pharmacy in Oshkosh. So if you guys are ever in the area or need anything, always feel free to give us a call. Right now, like you guys know, with social distancing, we're trying to minimize trips. So we do offer free delivery and curbside pickup, as well as after this presentation. If CBD is the right thing for you, or if you need anything else, always feel free to give us a call. We'll make sure we get you guys the products in the safest way possible. But I am excited to be here. I do wish that I could interact and see all you guys. I know the last presentation was excellent. I think there's about 70 people there, and we focused on dietary supplements. We had a lot of great conversation. There is a chat box function available, and I'll try to check it probably about halfway through. So this presentation scheduled from 10 a.m. to 11:30 a.m. I have probably about 2 hours of content, and I usually try to adjust it based on the audience. Right now, obviously, I can't, not sure the audience, but I'm going to try to make it all encompassing. So we'll start kind of with the basics, and then we'll get a little bit more in detail with the therapy, specifically focusing on CBD oil. And my second slide, I think, let me see if I can advance. 1 second. There we go. So my second slide, I think this was on my end, got deleted off, but it had a picture of my beautiful wife. She's a nurse practitioner in the area, and I think something that is very important to both of us is that we try to surround ourselves with people that think differently from us. So as a pharmacist and as a nurse practitioner, we're both kind of known as healthcare professionals, and a lot of hometown pharmacists are the pharmacists that doesn't like drugs or don't like drugs. And what that's meaning to say is, in healthcare, we do a great job, in pharmacists and medical doctors and nurse practitioners. When we see a condition, we know exactly on how to treat it with the medication. But what is missing, and if you look at almost all of the studies, is you combine the medication with either a lifestyle or a specific nutrient intervention. And it's something that there's not a lot of crosstalk between nutritionists and pharmacists and doctors and other naturopathic doctors. So it's really not pharmacists or nurse practitioners or doctors that don't like drugs. It's just that there's room for both. And instead of jumping to prescription medications, we should look at a lifestyle first, and supplements, and CBD oil is something that we look at quite frequently. So it's something that I'm going to really kind of focus on today as the topic of the presentation would discuss. And I do want to kind of let you guys know about my background. So I'm a doctor of pharmacy. I am a certified sports nutritionist, and I also consult for supplement companies. So it's something that I'm heavily involved with the creation and the ingredients that go into dietary supplements. And just like medications, everybody does not need to take all the dietary supplements you see on the shelf, but they can be helpful tools. And it's really our job as pharmacists to help guide people to making sure that the products that they're taking are, most importantly, safe, and second, effective. So if you guys do have questions on that, that's something that myself and other hometown pharmacists specialize in. And today we're going to focus specifically on what you see here, CBD oil. Oh, and I do want to make a comment too. I can't take credit for these beautiful slides. I have a lot of help from Ari in our marketing department. So thank you for doing that for me, for reformatting them. You'll probably see some slides that don't look as pretty. Those are ones I put in there last minute. So those are me. So what we're going to talk about today, first thing, really focus on what, when I say we, the medical and research community do know about CBD, and then most importantly, what we don't know. And then if you're considering CBD, or if you take CBD, or if you think a loved one can benefit, kind of where you should start and what you should do. And I know the audience is probably very varied in their understanding of CBD and their knowledge. So again, I'm going to start kind of a big picture, and then we're going to build from there, looking at some of the research. And again, as we go, feel free to type questions in, and I'll try to take some breaks to answer those, because during these presentations, there's usually a ton of questions. Like, as you guys know, in 2018, the kind of CBD was a very, very hot topic. It still is. There was kind of a bubble where everyone and their sister was selling it, and now it's kind of leveled out, which is a good thing because it is a great tool, but no, everybody does not need to take it. And we'll kind of go through those nuances here. So let's see if I can. So Charlotte Figi is a name that I always bring up when I start my presentations on hemp, cannabinoids, CBD, and other products related to marijuana. If you guys are familiar with Charlotte Figi, usually I'll ask and I'll get a raise of hands. A lot of people are. She was featured in the documentary Weed on CNN. I believe it was in 2012, and it's one of the main reasons why there's a lot more interest in the medical community on cannabinoids, specifically looking at CBD or cannabidiol, because of how impactful it was on Charlotte and some other children. So Charlotte specifically has a disorder called Dravet syndrome. And basically it's a specific seizure disorder in kids that she was having, I think it was somewhere between 50 seizures a day. So she was basically non-functioning. You see in this picture, this was Charlotte. I think she's about 5 years old in this picture. And her parents took her to all the specialists. We got what we do great at the pharmacy, got her on medications for seizure disorders. And as many of you guys know, the medications for seizures have a ton of side effects and aren't always the most effective. They decrease her seizure frequency and severity a bit. They even got her on a ketogenic diet. You guys know about that. It's something that's very, very low carbohydrate. Very hard, specifically for a child, to maintain that type of diet. That helped a little bit too. But what they finally went is they found these brothers in Colorado that were cultivating and farming a specific marijuana crop that was very, very low in THC and high in CBD. So she, I jumped to the punchline too quick, but they got her this product, and it was very high in CBD, and they found that it decreased her seizure frequency and severity to about 3 a month. So she went from non-functioning to being able to do things like a normal 5-year-old could, just with leveraging CBD. And an important thing about this story, it's a very heartwarming and very great story, but it's a simple story. So it's something that Charlotte has a specific condition that luckily we're now using cannabidiol or CBD to treat it, and it was very, very helpful for her. But again, there's a lot of nuance here, so that's what I want to go through. But it's an excellent story, and I would be remiss if I didn't mention earlier this year, unfortunately, Charlotte did pass away. It's kind of a small world. I know some of her, some people in the area that know her parents very well, and it's a great family. And unfortunately, it was related to a respiratory issue, and they think it is related to SARS-CoV-2 and COVID-19. So kind of a sad end, but she's someone who is kind of been life-changing for a lot of people, and her family has been a pioneer in helping people to get CBD who really need it. But an important thing I want to bring up from here, as you guys know, with stories like this that are great and heartwarming, is that you need to be wary of these simple stories. So as you guys know, in 2018, after the Farm Bill, there's CBD shops that popped up everywhere, some with good intentions to help people, some with the intention of just making money. And in my mind, it doesn't really make sense to have a shop just selling one specific thing, because there's a lot of money in CBD. That's why they could do it, and a lot of these are helping people. But again, be wary of simple stories. If someone is only selling CBD in their shop, you know that everything you have is going to be able to be treated by CBD. So just making sure that you're, again, working with your healthcare professionals to make sure that it is a good option for you, because even though I always bring this example up, your neighbor may have used it and it decreases pain, it increases, helped with his sleep. Even his dog started barking or stopped barking at the neighbors. Seems to help with everything. That last one was a joke. But it doesn't mean that it's necessarily going to be helpful for you. So let's see. So let's get on to kind of a little bit more about the chemistry of what CBD is exactly, where it comes from, and what's going on right now with the research. So an important thing to understand is before the Farm Bill in 2018, there wasn't a lot of research done specifically on CBD. So the NIH, the funding for it went from base zero in 2014 to an estimated 16 million in 2018, and this is continuing to go up. So a lot of the recommendations right now are based on, for better or worse, are based on anecdotes. So it's something just to realize that the science has not caught up with the hype yet, but there is a lot of exciting research being done specifically on, I think you see my cursor, on CBD or cannabidiol, and that's the one we're going to focus on today. But just know in the hemp plant, there are other cannabinoids as well, and a lot of research are being done on them, and then there's other compounds and terpenes. So this specific plant has a lot of exciting potential, and there are drugs, which I'll talk about, that actually use hemp extracts from hemp and marijuana for their products. So right now it used to be was dietary supplements or pharmaceuticals, and with this specific product, they're actually GW Pharmaceuticals is taking CBD specifically from hemp. So it's not synthetic, it is a pure CBD extract, and I'll talk about that versus the supplements coming up here. All right, so first question, a lot of you guys probably kind of know this answer, but there's always some misconceptions of hemp and marijuana. They're both from the same family of plant, the cannabis sativa plant, but the definition that really kind of matters, and there's various definitions, but is the legal definition. So legally, when we look at this, hemp, the second one is the most important. So legally, hemp is from the cannabis sativa family, but it contains less than 0.3% THC. And THC is the compound that we all associate with people getting stoned and people kind of sinking in their couches, having the munchies, and those psychoactive effects. So when we're looking at CBD products, in order to be federally legal, they have to have less than 0.3% of THC. So a CBD or hemp oil should not be psychoactive, and it is federally legal. There is a lot of gray area and nuance within this, but it is federally legal. And marijuana, on the other hand, again, looking at the legal definition, has greater than 0.3% THC. So I think this is an important distinction for people who are selling product or buying product that they're not doing proper testing on. They might think it's hemp, but if they're selling it and it has 0.5% THC, they're actually selling a Schedule I controlled substance, and that is not good in the state of Wisconsin right now. So something that is super important with dietary supplements, and CBD is no different. There is a lot of junk out there. As you guys know, I think there's every gas station, video shop, and everyone sells it. So if you are going to purchase it from someone that you know and trust, because there is a lot of junk and there is a lot of things that might being sold that might actually have more THC in them that is illegal. All right, so if you have questions on that, feel free to drop those in and we'll answer those as we go. I want to be mindful, so we're 15 minutes in, we're doing pretty good. So, and then we look at, so again, we talked about the big two that we differentiate is THC and CBD, and both of these have therapeutic benefits. So THC as a Schedule I controlled substance in the state of Wisconsin, that's where you can go to Colorado, go to a dispensary on the state level. You can buy marijuana for recreational use in Wisconsin. Cannot do that. And THC is the psychoactive one. So just like there's many medications that have risks associated with them, there is also therapeutic potential to use THC. But again, because of the risks associated with it, it's important to work with a healthcare professional, particularly if you're going in a state that it's legal, that you're working with healthcare, because there is risks associated with the THC component. So for CBD, when we're looking at some of the research, and again, this doesn't mean if you have these issues that it's necessarily the right product for you, but it's been shown to help with anxiety, can help with inflammation, can help with spasticity. And there's some specific trials that GW Pharmaceuticals is doing for multiple sclerosis related muscle spasms that it's been very, very safe and effective. So when we look at the main difference between the two, when we're concentrating down CBD, it has a wide therapeutic index, and I'll talk about that coming up, but it's very safe, doesn't have those psychoactive effects. So like we know with THC and opioid medications, even muscle relaxants and things we dispense in the pharmacy all the time that can cause these psychoactive effects, CBD does not or has very little bit of that. In a few people, it can cause some drowsiness. So I always talk to my patients, if you are going to start it at bedtime. But it's something that I have a lot of patients taking during the day. And I will admit I took about 10 milligrams of CBD before this presentation. There's actually been a lot of interesting studies on public speaking. I don't get nervous per se, but I tend to talk fast, and I'm realizing I'm talking fast right now. And I've noticed CBD, L-theanine, and a little bit of exercise before I present usually helps with that. So again, it is a tool. It is a tool that I use, but let's talk about some more science here. Okay. Same. I hope I'm going forward. Okay, perfect. So then what you'll see at, say, the gas station, the video store, or the pharmacy, or from your healthcare professional, where I'd suggest buying it, is these hemp extracts. So they put so we basically, what happens is they take this hemp plant and then they extract the cannabinoids and concentrate it down into an oil. So I think the three kind of distinctions that everybody should know when you go into a shop to buy a CBD oil is there's three main products that differentiate what cannabinoids that you're getting. A full spectrum hemp extract is what it says. It takes all of the cannabinoids, all of the terpenes, or depending how they process it, as many as you can get from the plant, and concentrate it down into the bottle. So it does have some THC, but less than 0.3%. And it's been shown it's called an entourage effect, and we use this all the time in medicine, where you want to use low doses of multiple medications. That's where I talk to a lot of patients about this, that the less medication, the better, but sometimes 2 or 3 medications at a low dose, you can increase the benefit and reduce the side effect than just being on one medication at a high dose. So it's similar with hemp. When you can use all these cannabinoids together, you can use a lower dose and have a better efficacy and a lower side effect profile. The second one, for people who are adverse to THC, or maybe you have drug testing, and I should note too, for all of these, there can be a false positive on a urine test. So before you use any hemp-derived products, make sure that you talk with your employer, because some of these other cannabinoids can pop a false positive. But so full spectrum, all cannabinoids. Broad spectrum is all the cannabinoids except we eliminate THC. So, and again, a small amount of THC is helpful, and the amount of THC in a professional full spectrum hemp extract is not going to cause any of the psychoactive components. So my preference with almost all of my patients, if they're comfortable using a low amount of THC, is a full spectrum hemp extract. And then the last one is what's called a CBD isolate. So then we just look at just using CBD. So a lot of the prescription drugs that you'll see in a lot of the trials that you see are using CBD isolates. So they remove all of these other cannabinoids, all these other terpenes, all of these other compounds, and they just concentrate down the cannabidiol. It sounds similar to what we do in medicines with drugs. We do this all the time, and sometimes it's a good thing. Other times it's not such a good thing. For hemp extract itself, you have to use a lot higher dose to get the same benefits. So you spend a lot more money, you don't get the same benefits. So it seems to not be the most effective. So kind of a hierarchy if you're looking for products. Always start talking about a full spectrum, then a broad spectrum, and then you can look at a CBD isolate. All right, so that's another beautiful picture. So the next thing is the definition. So the really kind of cool thing is our body actually makes what's called endocannabinoids. So let's see if we get that perfect. So the second definition you see on the screen there is endocannabinoid. So endo is just the prefix for endogenous, just basically means our body makes these. So it's something that when someone says hemp is quote unquote a natural substance, it's true because of the it's a plant and our body makes these compounds that are called endocannabinoids, and the two that we make are anandamide, otherwise 2-AG is the other one. I think I have someone drilling here, but I think they're done. But so basically our bodies make these endocannabinoids, and a lot of the theory on why CBD is so impactful for certain people and not other people is because of something called endocannabinoid deficiency syndrome. So it's something that there's no blood test currently, but kind of like some people have low vitamin D and we get that lab measurement and then we get their vitamin D up. It can help a lot of different processes, everything from mood to bone health to muscle function. And it's the same thing with our endocannabinoid system. If we have a low endocannabinoid tone, by giving someone phytocannabinoids, and phyto just means plant, so cannabinoids from plants like marijuana and hemp, it can be very helpful for these people. And other people who, for their example of low vitamin D, if someone has normal vitamin D, I give them a little vitamin D, their body already has enough. As long as they're not going too high, they're going to feel the same. And it's the same thing with hemp and phytocannabinoids. I think the one main takeaway here is that there's no good blood test. So if you're having some of these symptoms, it's something that we try to use to make sure that that it's not an endocannabinoid deficiency. And I'll talk about at the end kind of titrating up on the dose, but if you're starting, you want to start slow and go up. And I've got a handout for that. I'm not sure if there's an email list, but I'll try to get that to you guys the best way possible at the end. So two definitions: phytocannabinoid, these are the things from plants like CBD and THC. Endocannabinoid, these are things our body actually makes, which is pretty cool. And this is a simple story. So this is how I can kind of sell you guys to all take CBD, which again, you guys know maybe you don't need CBD, but again, it can be a helpful tool. But it's kind of cool that in the human body, the endocannabinoid system is believed to have more cellular receptor sites than any other receptor system. So this kind of theoretically explains why certain people, when you give them a phytocannabinoid like CBD, it can have so many impacts in terms of pain, anxiety, sleep, and in Charlotte's case, decrease their seizure frequency and severity, because if we're low on endocannabinoids, is going to affect a lot of different systems. So when we look at the systems in the body, I do a lot of presentations on these other systems. It's not one that's a master regulator of all of these other ones. They all have feedback loops going back and forth. So when we look at medicine, this kind of, in my opinion, what's one thing that's kind of wrong with medicine, there's not a lot of crosstalk between a lot of the professions. So you got pulmonologists, you've got your endocrinologists, you've got your cardiovascular people. So it's something that we live in buckets, and it's a system that have feedback on one another. So when something's going wrong in one of these systems, it can impact all of the other ones. And one of them that hasn't really been talked about until 2018 is the endocannabinoid system. So this is just another system that we want to make sure that's functioning properly to make sure that we are being as healthy as possible. So again, just kind of the importance of endocannabinoid system. So we're hardwired with the master control system called the endocannabinoid system. And again, it doesn't mean that we should only need to fix that. There's a lot of other things we need to fix. I've given a lot of presentations on the digestive system, as many of you guys know who's been to those. If your digestive system, if there is increased intestinal permeability, if you have a a microbiome disorder where the bacteria is off. It can in fact affect tons of processes as well, but we are focused on endocannabinoid system today, so that's where we'll stay. And so there's cell receptor sites all over the body. It gets talked about. I gotta move one thing. CB1 and CB2 receptors all the time. So they're in the brain and spinal cord. They're in the immune cells, GI tract, and everything outside. So basically, as we can see, they have impacts on all these other systems of the body. So if we have low endocannabinoid tone, that it can have ranging. The symptoms can be ranging. That's why it can be so hard to diagnosed, because each person will present a little bit differently. But again, talking to your healthcare professional to see if this is something that we should look at. All right, so let me see. Oh, I forgot. I gotta use this. Perfect. So this is just gonna kind of breeze through this because I want to make sure I get to some other things. But this is just reiterating that we have these CB1 and CB2 receptors through different systems in the body, and it may be helpful using phytocannabinoids. And again, more importantly, and I'll talk about this, there's other ways to optimize our endocannabinoid system without just using CBD or THC and I shouldn't say THC, not THC, but using phytocannabinoids like CBD, CBG. You can actually, there's some lifestyle changes and nutrition changes that you can make to improve your endocannabinoid tone. But again, it has effects on all of these things. So let's see. Perfect. All right. So what can we do to optimize our endocannabinoid system? So the important system we just talked about, what can we do to help with that, to maybe help with anxiety, help with insomnia, help regulate pain and inflammation? So drum roll, is it drugs? No, it's lifestyle. So that's a place to start. So, and again, if we're looking at whether we're looking at improving our digestive health or body composition or cardiovascular health, it always starts with lifestyle. I think this is one of the biggest things that's missing in traditional medicine, and because of the short office visits and time we have with people, we always just say, hey, yeah, move more and eat less, and that doesn't work because each person is very different, and each person has different issues with different systems. So this is where we need a more targeted approach to lifestyle. But if you're thinking that your endocannabinoid system is low or has low tone, some things that are coming up in the research is diet, first of all. And again, easy thing, shopping the grocery store, not easy, but the common thing, shopping the grocery store outside in. And EPA and DHA is an interesting one. So this is something I talk about with almost all of my patients, and I say, hey, if I was going to open or just be able to sell, say, 3 nutrients on over the counter, they would be an EPA and DHA, which is specific omega-3 fatty acids and a fish oil, so good quality EPA and DHA, a vitamin D with K2, and a magnesium, because these 3 things that most people are missing from their diet, and when we get those back in, it helps with a lot of different things. So focusing on EPA and DHA in the diet, where to get them from food, look at the smashed fish, sardines, mackerel, anchovies, salmon, and herring. But if you increase your EPA and DHA, you can decrease some of the inflammation in your body, and it can help with your endocannabinoid tone. Second thing is exercise. Usually I'll ask this to the audience, if anyone was a runner or is a runner, has ever done a high intensity workout, you get what's called a runner's high, and I'm sure a lot of you guys have experienced this. And what this is actually one of the compounds one of the transmitters that's increasing is anandamide. So that's that compound we talk about that binds to your endocannabinoid system. So that runner's high where you feel really good when you're stressing your body is actually your endocannabinoid system creating more anandamide. And it's something that has a positive feedback loop. So it's something obviously you don't want to be running all day because too much stress is not good, but having some time of low stress, so some type of meditative yoga, Tai Chi practice, staying off of Facebook is important. So you want some low stress, but then you want some time of high stress too. And each person is very different. So working with a good physical therapist or a good trainer to find what your body can handle. But sometimes of low stress and high stress, creating this gradient is helpful for your endocannabinoid system. And unfortunately, with our current situation, it's if you see Netflix, I think stock is just crazy. People are sitting on the couch watching Netflix all day, which isn't a bad thing as long as you augment it with some activity. It might be as simple as getting outside and going for a walk, but having some type of movement will help your endocannabinoid system a ton. Environmental toxins, I don't want to go too deep into that. Got a whole presentation on that. That's a whole nother hour, but just knowing exposures to certain things are not good for a lot of your systems. So stress, both real and perceived. This is why the 24-hour news cycle, Facebook, I don't have Instagram, Twitter, anything like that, fortunately, because I have a very addictive personality. But these type of things, even though they're not putting you in real danger, they're creating this chronic stress. So it's trying to stay out of those things if you can. And yes, we all need to pay attention to the news, but making that a smaller part of your day will be helpful. And then sleep. And there's a lot of things that we can talk about with sleep. I was just on Living with Amy. I think it'll air next Wednesday, discussing the importance of sleep, but this has feedback back and forth. So again, I know this presentation is on CBD oil, but I just want to make a point that you don't need to take CBD oil to optimize your endocannabinoid system. But once we get those things dialed in, or even if we don't have those things dialed in, the next thing we look at even before jumping to CBD is foundational dietary supplements. If we look at the triage theory, and again, this is replacing micronutrients that we may be missing from our diet. Big ones that people are missing are vitamin D, magnesium, and EPA and DHA. So things to work with your pharmacist or doctor to see if those things are useful. And then, so let's see, it's third on the list. Then we look at full spectrum hemp extract. A lot of times with my clients, I will move this up to number one, just because once you can have that lead domino to get the ball rolling, someone might be in so much pain, have so much anxiety, have so much sleep that they're just not going to make these changes. So using this can go up to number one, and then it can create a positive feedback loop to improve these things. So just knowing that just going into a nutrition store or a grocery store and buying CBD, it's not necessarily, it can be a part of the plan, but making sure you're working with someone that can help guide these other things, because they're all things we need to do. And then we look at prescription medications, and again, these are things, these are things that sometimes will move to the front, and unfortunately in the current healthcare system, what we usually do is we say, you have symptom X. What prescription medication can I prescribe to help with symptom X? So prescription medications are good tools, but they should really be looked at last. And again, they can be moved to the front with the goal of leveraging these things and decreasing them. So if you're looking to optimize your endocannabinoid system, help with stress, help with pain, help with anxiety, starting with lifestyle. And again, this varies from person to person. So I'll put it at the end, but I do personal consultations. If you just have a simple question, always feel free to reach out. All right, we are 10:30. I'm just gonna see, right, is there any questions? Okay, perfect, excellent. Always feel free to put in questions if you like, but I'm going to keep going because I have plenty of content left. So I think this is just to reiterate on the endocannabinoid system and lifestyle. When we look at what we eat, oh, here we go, something happened. Okay, so these are the most commonly consumed vegetables. I know this from 2014, potatoes and tomatoes. So it's something that we're really missing micronutrients in our diet, and by missing these micronutrients, it causes a lot of issues. And endocannabinoid system is one of these things that is negatively impacted by missing these micronutrients. And unfortunately, we look at potatoes and tomatoes, you think, okay, those are good, those are vegetables, but how we're eating them in the diet, if it comes up, is French fries and ketchup. So that is not a very nutrient-dense way to get vegetables. So again, just realizing, and this takes time, that instead of using a Band-Aid with prescription medication, to work with a dietitian or someone like myself who can kind of go through the diet and get a little bit more specific on things to help fill in gaps. And these are usually the areas that people are missing. These are things that I eat. You don't need to eat these things, but so we look at EPA and DHA, sardines. This is my favorite brand of sardines. I hope to sell it to pharmacies sometime soon. Fruits and vegetables. Organ meat's an interesting one. I won't spend too much time on it now. Getting outside, even in the winter, our body's not going to make vitamin D right now because of the angle of the sun, but there's so many other benefits to getting outside and being in sunlight, even if we're not getting the benefits of vitamin D. But in the winter, what we look at right now and kind of supplement almost everybody can benefit from is a low dose vitamin D. And when you look at immune system and immune health, getting flu shots, social distancing, most important, but leveraging vitamin D is something that's very important in the winter. We got some green smoothies and some natto, but let's get back to some hemp and CBD. Okay, so this is, I think, one of my favorite quotes, and this is in relation to CBD. If you guys are interested in taking a little bit more deep dive, Dr. Kent Hutchinson has some great free lectures that are on, I think they're on YouTube now, that he talks about the science, and he's doing some of the research with CBD and other cannabinoids. But he says people think it's great for everything. That can't possibly be true. But I do think it's going to be great for some things. We just need to figure out what those things are. And this was a quote from 2018. And fortunately, they're finding more and more on what CBD and these cannabinoids are helpful for. But just know that it's not meant for everything. So right now, well, not right now, but it's getting a little more nuanced, which is good. But in 2018, when you saw these shops pop up, all these MLMs, everything looked like a nail to them. So everything was, oh, you have endocannabinoid deficiency syndrome. I'm going to use my hammer, which is CBD oil, and hammer you in. So even if it was a screw, and we're better off to use a screwdriver or a different approach, CBD has kind of been a hammer. So that's why it's good to have a more nuanced approach to this and everything in medicine and dietary supplements as well. There's not one size fits all. All right. So I do want to talk a little bit about the products that are available prescription only. So it's something that, again, for better or for worse, a lot of the research on CBD isolate is from GW Pharmaceuticals. So their product, Epidiolex, is something we dispense at the pharmacy not too frequently because it's something that's, again, for some specific seizure disorders is what it's approved for. But this is a CBD isolate. So we see it is a very concentrated CBD. And this one, when we looked at Charlotte Figge, it was approved for Dravet syndrome, LGS, and other specific seizure conditions. So they're using the same CBD from a plant, but if you look at the overall cost of it, it is almost $3,000 for a bottle of it. And they did a lot of research on it, but for better or for worse, it's super expensive. The good news is insurance doesn't cover it. There's no one in their right mind that's going to pay that out of pocket. That there are products that you can get, professional products, like the one shown below, that is a lot more cost effective. It's still not cheap, but it's cost effective. And one thing I do want to note with CBD and dietary supplements, cheap is usually a good indicator that there is there's steps being overlooked or things that are being not taken carefully to make sure you have what you need. Because unlike pharmaceuticals like Epidiolex that have to go through rigorous third-party testing at the end, the supplement companies and CBD is kind of in a gray area of regulation. They regulate themselves, so they could really put whatever they want in this bottle here and label it as CBD, and you wouldn't know the difference. Basically what I tell people is the only way to know for sure what you're getting is to have it tested yourself, but that is not feasible. So the most important thing is work with a company that you know and trust, and this is one of the better companies, Ananda Professional, and we go through, myself and my team, tons of different companies. We've probably been through 50 different companies, and very few of them are taking all the steps necessary, so we're confident in what's in there. So just something to realize that dietary supplements and CBD is kind of the worst offender. Just because something is cheap and says it's 1,000 milligrams, probably something else going on there. So I do want to talk about, this is exciting. It's not available in the US yet, but in Europe and a lot of other countries, there's a product called Sativex. This is where a lot of the research on multiple sclerosis and spasticity. So muscle spasms specifically related to multiple sclerosis, but they're doing studies now on other nerve disorders and other idiopathic, or basically, they're not sure of the cause, muscle spasms, and using CBD and using THC, and it's been very, very helpful, and it has a lot lower risk than some of the muscle relaxants that we use commonly in the pharmacy, like you guys probably know, Flexeril, cyclobenzaprine, methocarbamol, and things that will help as a muscle relaxant but have a whole host of side effects. So they make an oral mucosa spray. It's not currently available in the US. It's in phase 3 trials right now. I think they're shooting for sometime middle of next year. With COVID and things, I'm not sure if that's gotten delayed or not. But the cool thing is, a lot of the reason we have a lot of research on the muscle spasms is because of the drug companies doing research on it, and we can extrapolate this out to full spectrum products. It's not a 1-to-1 ratio of THC and CBD in any of the products you're going to be getting over the counter, but a full spectrum product has been very helpful for a lot of my clients anecdotally, and when you look at some smaller trials as well, and doesn't have the risk of the high THC. So this is something, if you have muscle spasms or on a muscle relaxant or know anyone that you do, using a full spectrum CBD oil can be very helpful. And also, if you're not sure of the cause, I work with someone like myself, they're a pharmacist. A lot of times it can be even simpler than that, and we see magnesium deficiency or potassium deficiency being the cause of some of this muscle tightness and rigidity. So a lot of times you don't even need to go to CBD. We can just replete some magnesium with some low-cost magnesium glycinate, and these things go away. Other times that's not the case. But again, talking to someone who can kind of start from the bottom and work their way up is what's important. But it is very exciting to look at some of these trials. So I'm going to get into, got 16 minutes, just a little bit of the weeds here, just to look at some of the trials and some of the papers out there. So we look at CBD, and this is why I recommend it quite frequently for pain and inflammation. And this is a study that specifically looked at beta-carotene. So this is actually, so we look at beta-carotene, it's not a cannabinoid, it's actually a terpene. So if we're not getting a full spectrum CBD tincture, you're not getting this in this. So this is why sometimes if you just get a CBD oil that's a CBD isolate, it doesn't help for pain and inflammation, where someone switched to a full spectrum, it can help. So this is why, again, my bias is using the full spectrum, because you have low levels of a lot of different compounds in there. So you get the benefits with less side effects. You don't need to go as high. But, and again, important thing to note here, this is in mouse models. So a lot of research in mouse models doesn't translate well to humans, but there are some bigger trials now or smaller trials in humans that it has been helpful. And again, the anecdote and subjectively for my clients, it's been helpful for a lot of people. So something to consider if you have neuropathic pain is the full spectrum. And then chronic pain, and the reason that I'm bringing these up is a lot of the things that we use to treat neuropathic pain and chronic pain have a lot of side effects. So if you're someone who's taking gabapentin or someone who's taking an opioid medication, it's much safer to first look at leveraging something like a CBD oil, and again, a good quality professional CBD oil before jumping to these things. My goal is always to help to decrease the need for medications that cause some of these issues. So when we look at pain, there's data coming out on pain, and again, each person's cause of pain is different. So just because CBD worked for someone for pain doesn't mean it necessarily worked for you, but it is something that's worth trying if you do have pain and inflammation. So we see that there is conclusive or substantial evidence for the benefit of cannabis or cannabinoids for chronic pain. Something to note here, they actually look at cannabis, so they're using some of the studies in this paper were using THC, some are using CBD. So THC can have benefit as well, but again, starting something lower risk with CBD is where we want to go. And high THC products below 0.3% in Wisconsin are currently illegal, so don't do that. All right, anxiety disorders. This is when we talk about endocannabinoid system as well. So before jumping to benzodiazepines like diazepam, alprazolam, clonazepam, these are all things that used in small quantities for a short period of time can be helpful, but there's a lot of issues with using these long-term or using these on a scheduled daily basis with decreasing central nervous system. So basically causing brain fog, you might not notice it, and then they don't work as well the more that you use them. So using cannabidiol or CBD for anxiety disorders, particularly for people on medications for anxiety, is always a good place to start, or you can even add these on to this therapy so you don't need to move up in them. So there's good research in anxiety and insomnia, and this is important to note. So insomnia, the causes of it, there's multiple different causes, but when you look at anxiety related insomnia, CBD can be very effective. So if you're someone at the end of the day, and I get this every once in a while, so I'll use CBD, and my preference, I'll use a product called Evolve Sleep. Doesn't have any CBD, but it's got some melatonin, L-theanine, and magnesium. But CBD itself can help for anxiety. So if your kind of mind's racing at the end of the day and you can't quite turn your brain off, CBD can be a helpful tool to use somewhere between 5 to 20 milligrams an hour before your planned bedtime. And it's something I use quite frequently with my clients and my patients because, again, a lot of the sleeping medications, Ambien, and even though things are over the counter like ZQuil and NyQuil, does not mean they're safe, have a lot of issues with them. But for other sleeping disorders, CBD isn't very helpful. So just to know that just because you have insomnia, CBD might not be the tool for you. And there is good research specifically on REM sleep behavior disorder. So I should mention this too. So this is basically people getting out and acting out their dreams that CBD can, or people who yell in their sleep. So if you have a partner that does this, maybe give them a little CBD. But so it's been helpful for that. So again, endocannabinoid deficiency syndrome, and this isn't something that's really recognized in medical research yet. It's a theory. There's not a lot of labs, but it seems that people who respond well to phytocannabinoids probably have endocannabinoid deficiency syndrome, and it can present in a variety of ways. So if you're dealing with any of these, particularly if it's the triad, and you're using other prescription medications or before jumping to medications, having a conversation with your pharmacist and your healthcare professionals about leveraging phytocannabinoids like CBD is something that I would definitely consider. You got 10 minutes. So I do want to go over, and these are important thing with this. These are anecdotes. There's good data for epilepsy. So we have some patients who use Epidiolex, other patients who either don't have insurance or have seizure disorders aren't covered by that. And again, make sure you work with your healthcare professional before using CBD because there is interactions with some anti-epileptic medication, but CBD has been very helpful for some of my patients with epilepsy. Chronic pain, again, looking back to the theory of endocannabinoid deficiency syndrome, CBD can be a helpful tool for chronic pain. And anyone going off opioids and benzodiazepines, you guys know the healthcare professionals, we've done a terrible job over the last 20 years of overprescribing opioids. We're finally starting to realize that and help people, but the problem is now trying to taper people off is another big conundrum. So using CBD oil with someone tapering off any of these things, having withdrawal symptoms, can be a helpful tool. And again, pain related to muscle spasms specifically, but other chronic pain it can help for. So anxiety, social anxiety disorder has the most evidence. If you're giving a presentation like I am now, it's also something to consider. But just like I tell athletes that I work with, don't do anything different on game day that you haven't already tried in practice. Don't take CBD oil before a presentation if you've never taken CBD oil, because some people it can cause some drowsiness, and I don't think your audience would like it if you're sleeping. So, but it's something to consider if you're in if you're going to a situation that might be stressful. Using a little CBD before can be helpful, but again, use it before that so you know how it affects you. And then we look at inflammation. So again, migraine headaches, a lot of medications that have a lot of downsides. So whenever we can leverage something safer like a phytocannabinoid, CBD, and using his lifestyle, very, very helpful. My wife specializes in chronic infections like Lyme disease and other neurological issues, and she uses it quite frequently for these patients to help ease some of these symptoms, because a lot of times with things that have a lot of stress, again, remember the perceived and real stress. A chronic infection is a real stress on the body, and that chronic real stress really taxes the endocannabinoid system. Where using phytocannabinoids can be very helpful. Arthritis is an interesting one. There is data using it topically. My preference is there's a roll-on product that's a full spectrum product, so you don't have to get it on your hands, so you can use it kind of like if you've seen those BioFreeze roll-ons, and you apply it right to the joint. The good thing with that is you can kind of concentrate it to the joint. There's debate on whether it gets to the joint itself or not, but it does seem to help with the symptoms. And again, like most topicals, very, very low risk. So before jumping to an oral NSAID like Advil and naproxen, those type of things that can be helpful, but they're really hard on the kidneys, hard on the stomach. I would much rather try to do a topical CBD. And there's interesting things. Unfortunately, there's not a lot of football going on right now, but traumatic brain injury. If I had a high school age or anybody, if I had a child playing football, I would heavily consider using CBD, because of those head-on-head collisions. The CBD has been shown to be effective if there has been any brain trauma, but I won't talk about that too much. Insomnia, and again, not for every type of insomnia, but if it's anxiety-related sleep disorder, can be helpful. The other thing that can be helpful, I should note, for insomnia, if it's pain-related. So a lot of times insomnia is related to pain. So if you have terrible pain in your shoulder, your body's obviously not going to be able to relax enough to go to bed. So using CBD can be a helpful tool if your insomnia is pain-related. Pets is another great one. My wife and I use it quite frequently with particularly one of our dogs, Moby. He is a little anxious around kids. He's a rescue, so whenever we take him to places where there's young kids, we will give him a small amount of CBD oil, and they make pet-specific CBD oil. Just as a tip, most of these are exactly the same if the company makes them as the human CBD oil, so you can, if you're using some for yourself before buying a bottle for your pet, you can use that. You just put a little bacon flavor in the pet CBD oil. All right, so this is a theory. So why it worked for these people is these people all likely had endocannabinoid deficiency syndrome. So again, I'll have some people that I recommend, and we go through this I go through some questions and I see if it's a good fit, and they come back in a week and they say, oh my God, you changed my life. Like I don't have to use as many pain medications and things that other people where I think it is going to be a slam dunk. If they're having arthritis, they're having sleep issues, we get them CBD, they come back the next week, they say, nothing changed. So unfortunately, because there's no good blood test for this, the only way to know is to work with a healthcare professional and try it. But an important thing here is you want to make sure that you're using a product that you know exactly what's in there, because the worst thing is to think something doesn't work, but it doesn't actually have the CBD or nutrient or whatever it is in there. So for dietary supplements, CBD in particular, more expensive is not always better, but you want to look for products and companies that are professional products that do third-party testing, so you know exactly what's in there. For over-the-counter products, and again, my goal is always most cost-effective. So say like an Advil or ibuprofen, I'm always going to go with the generic ibuprofen. The reason is these are regulated in such a way that you're just paying for the branding of Advil versus ibuprofen. But for dietary supplements, it's not the same thing. So I would stay away from store brand or gas station anything. Gas station ibuprofen's fine. So then areas lacking evidence. This is something when I gave presentations, people would tell me all of these stories, or their friend told them that can be helpful for all these. And there's actually is some more data on Crohn's disease, but just know it. If someone's telling you that it's helpful for everything, it's likely it may be helpful, but it's something that there's not a lot of data for a lot of these things. And important of note for schizophrenia, certain cannabinoids, specifically THC, can make these things worse. So something to just to keep an eye on, and again, have a discussion with healthcare professional. I've got 3 minutes left before questions. You guys can start typing, and I've got more content too. So if there's no questions, I'll keep going. But I do want to, I did make this point before, but I do want to make this point of therapeutic index. Why I'm comfortable recommending CBD to a lot of people is because it has a wide therapeutic index. So basically what this means is if I give someone a bottle of 300 milligrams CBD, they take it home, I say start with 10 milligrams of CBD, which is a dropper, and it has marking as 1 milliliter, and they instead forget and they say, oh, I think you said drink the whole bottle, and they would drink the whole bottle of CBD, which is 300 milligrams. The good news is in studies, they use up to 500, 3,000 milligrams. So it would be very safe. I mean, not very safe, but it would be safe. I would have less concern about that than if someone were to take, say, ibuprofen home and I tell them to take 2 tablets of 200 milligram ibuprofen and they accidentally think I said 20. So it's something that CBD, even when taken at higher dosages, is very safe. But again, we want to find the lowest effective dose. So just because it's safe in high doses doesn't mean you should take it in high doses. And to get a good product, it's quite expensive. So to take that high amount, you're going to be spending a lot of money where you probably could have used a lower dose. And important thing to note with everything, people says, hey, JJ, can CBD kill you? So, well, yeah. I mean, water can kill you. So it's something that even with water, have you guys seen these sad stories of these radio, I think it was like some of these radio contests where someone would try to drink so much water, and they drank so much water that they basically diluted out potassium and a few other electrolytes, and they had a heart arrhythmia. So even water has a therapeutic index, but just know that CBD does have a wide therapeutic index, but this isn't a reason to take high doses. It's a reason to start low and go slow. So we find this spot here because if we're getting same benefit here as here, why spend more money? An important thing to note with this, so just so I can make an example, warfarin, if anybody's on that, that's an example of a narrow therapeutic index drug. So just a small incremental change, say if someone's dose is 5 milligrams, they accidentally take 10 milligrams, that can cause them to bleed out and die. So that's why we do warfarin lab testing, where CBD, it's something I'm pretty comfortable with most of my patients. All right, I think I made that clear. And then an important thing too, okay, I'm going to talk about this second because I want to talk about drug interactions. I think I have, yeah, drug interactions, perfect. So an important thing why, to me, it's important whenever you're getting a dietary supplement or an over-the-counter product, just because it's over-the-counter doesn't mean it's safe for you. I think everybody knows very well, and doctors do a good job of talking about certain people with kidney issues or stomach issues. Ibuprofen and naproxen, or Advil and Aleve, although they're over-the-counter and can be helpful for certain people, if you take them, you could have big issues. And CBD is the same way. There's a lot of drug interactions. The good news is most of these drug interactions aren't clinically significant. So the main ones, if you are on warfarin, again, we talked about a narrow therapeutic index drug, make sure you talk to your pharmacist or doctor before starting a CBD oil. And then atorvastatin and simvastatin are two that can slightly increase the concentrations of these, similar to how your doctor, or similar to how your pharmacist talked to you about grapefruit juice and statins, CBD can have a similar effect. But just know that there's a lot of drug interactions with CBD and a lot of other quote unquote natural products. So just because something is natural, again, doesn't mean it's safe for you. But this isn't meant to scare you. Most people, even on medications, I'm comfortable using CBD. We just want to just to see how it affects things first. So again, consult with your pharmacist before starting or stopping any dietary supplements, whether it's a fish oil, a CBD, magnesium, or the new proprietary blend your friend's selling to you online. Talk to your pharmacist. But then I do want to go back quick, 11:01. So I promise I'll leave time here, but I just wanted to make a quick point. So the reason the tinctures are available is because, and technically as a dietary supplement, they can't advertise it to hold it on their tongue, but I teach people to do this because the absorption is better sublingual than if you were to take a soft gel. So I always recommend, if someone is okay with the taste, to do the sublingual tincture, because again, it's going to be more cost effective. The same oil is put into the soft gel, but you're going to have to take a higher dose. It's going to cost you more. So using the liquid oral mucosa, holding it under the tongue, is the best way to go, because you're going to get more bang for your buck, and you're not going to have to spend as much, particularly if you're getting a professional product, which you should be getting. If you are taking the oral one, just don't like the taste, make sure to take it with fat. So CBD is fat soluble, so you're going to get better absorption, just like you would with vitamin D or any fat soluble vitamins. Take it with the fat. There are places selling vaporized CBD. It's something that I do not recommend and definitely would not recommend. I think you guys all remember the issues with the vape cartridges with THC products. When you have something that's an oil, even though you use something that's safe, if you ingest it, like vitamin E acetate, when you put that into a vapor, it is not good. So although some CBD shops might be selling this and it's a higher absorbed, quicker onset of action, I would stay away until, quite frankly, I would only use this if it was made into like a inhaler where a drug company is making and regulating. I wouldn't trust any of the vaporized products. And let's see. Okay, so with that, I do want to, I've got other things, so I'm going to see if there's questions. I'm going to leave about 5 minutes. No questions. Okay. Can you read it to me? Oh, sorry. Okay, good question. So the question is, do you suggest taking CBD more than once a day? And the answer to that is it depends. So that's a very good question. So each person is very different. So I will always start. I just want to get to my last slide so I can have this up, so I can clear my mind. Let's see. Okay, I need to get this up. So I'll always start someone in a good kind of place to start for everybody is about 10 milligrams and in the evening. So the reason we'll do that is about less than 5% of people can get some drowsiness from it. So if you're one of these people, you want to make sure we're starting it at bedtime to make sure that's not an issue, but we'll do that for 3 days. And then depending on the symptoms that we're treating, say if I'm treating anxiety, and a lot of the anxiety is during the day, and you tolerate that dose at night fine, or after supper, say, yeah, it helps my anxiety, but it doesn't make me tired, then I can move to twice a day. So for anxiety, for inflammation, those are kind of the main two. There's other things obviously we're treating too. I will do a morning dose and an evening dose, but we'll always do the first trial dose in the evening. Where it seems to, most people seem to stabilize at is between 10 and 30 milligrams. And it's usually, if the pain is throughout the day, if you can, to spread that out into 3 different doses. So as you do 10 milligrams 3 times a day. But if the issue that I'm treating is insomnia, we'll just dose it at bedtime. So I start 10 milligrams 1 hour before bed for 3 days, if that's helpful, but not sufficiently helpful, increase that to 20 milligrams in one dose? So that's a really good question, and the answer is it depends. I do have people taking in the morning, but before taking in the morning, I would be sure that you know how it affects you and start at bedtime. Excellent question. Good question. So the next question is, there are many different stores selling CBD. Do they sell the good stuff? And that is a good question. It's something that, in general, I would buy from a healthcare professional. So no matter where your pharmacy's at, if you trust them to dispense your medications and over-the-counter products, they're hopefully doing their due diligence on CBD and selling a high-quality CBD product. I will point out two companies that I commonly recommend. The only one that Hometown Pharmacy currently carries and recommends is Ananda Hemps. We have 72 stores throughout the state of Wisconsin, so no matter where you're at, there's probably one in your area. And quite frankly, for 2 years, myself, some other Sean Casey, some other members of our science team have been going through CBD companies just to try to get a more cost-effective product that hits the same standards as Ananda, and we're in the process of finding one, but haven't found one yet. So I guess I'd look at the brand that they carry, and I should make a note. There's so many brands out there. I don't want to disparage any companies and say that they're bad. Just there's so many out there that I can't review all of them. But of the 100 companies I've reviewed, Ananda is the only one that our pharmacists are comfortable selling and stocking at this time. And again, because it's a professional product, it is more expensive. One you'll find at a lot of health food stores that there's a couple things that they didn't do and a couple of things that we weren't comfortable carrying them, but that you can find almost everywhere, and is Charlotte's Web. So that's a company that, as you guys know, is Charlotte Figge. It's named after her, and they've been around for a long time. So I do trust them. They're just they weren't that transparent with us. That's why we didn't things. And one important note, if you're going to buy online, make sure you buy either directly from the pharmacy or directly from the company, because for a lot of higher cost dietary supplements, there's a lot of counterfeiting. So I never recommend buying dietary supplements off Amazon. I would question the shipping practices. I'd question what you're actually getting. But a lot of the good health food stores will carry brands like Charlotte's Web. So again, these are two brands that I trust, and the only one we carry at the pharmacy right now is Ananda. We're looking at other brands. So for me to make a broad statement and say these other hemp shops aren't selling quality brands, I do not want to make that statement because I'm not sure. But so just make sure whoever you're going to, you know, and you trust the people who've done the vetting in the shop. Cool. Any other questions? I appreciate you helping me. Good question. So the question was, what unique considerations do I take for fibromyalgia patients? Getting back to the multiple sclerosis, it's something that I always look for, no matter kind of what the possible endocannabinoid deficiency syndrome might be. I always look at the full spectrum first. So no matter if we're treating fibromyalgia, multiple sclerosis related muscle spasms, or insomnia, we want to have the broadest amount of coverage with the least amount of side effects. So starting with a full spectrum hemp extract is the place to start. For my fibromyalgia patients who's been helpful with CBD, this is an anecdote, but what I've noticed is they do need to take higher doses than people who say are just trying to treat insomnia or are just trying to treat pain. So one thing I would say is you may need to go up to as high as 60 to 100 milligrams spaced out. 3 times a day, but I would do the same, start low and go slow. So an easy way is 10 milligrams for 3 days, and every 3 days bump up by 10 milligrams. And we give out journals in the pharmacy so you can kind of track your symptoms, because there's no great lab tests like there would be with vitamin D. There's no one size fits all approach. And like I'm sure this person knows, the fibromyalgia, the causes aren't known. So there's a lot of different things that could be underlying there that CBD can help with that endocannabinoid tone. But then I'd also make sure that your omega-3 index is high. So for all my fibromyalgia patients, I'd recommend a higher amount of omega-3. And then we look at other things like magnesium, like that. But so I think the main takeaway there is, for treating fibromyalgia, you may have to go higher dose than some other people may, but just start low and go slow with it to help with symptoms. Good question. So the question was, is Ananda hemp, which is shown here, a prescription product? And it is not. One of the main reasons that we partnered with them first was that Ananda, a lot of research being done on CBD is being done on their product specifically, and they've got a lot of research being done on their product at Thomas Jefferson University, and they're very transparent, but it is available over the counter. So if you guys, no matter where you're at in Wisconsin, all hometown pharmacies do carry this Ananda. And again, because of social distancing and those things, if you want to come into the pharmacy and discuss, that's at your discretion. But our preference would be, always feel free to call us over the phone. We can get you information, and then we can set up either a curbside pickup or a delivery or mail for you. But yes, all hometown pharmacies do carry Ananda hemp. One caveat with hemp oil is, my preference is I do mail it to people, and with the temperatures now, it's usually okay. But my preference is to not mail it, because you can't temperature control it. So it's something that most pharmacies will offer local delivery and curbside pickup, but it's not a prescription. You can buy it over the counter, and it's available at all hometown pharmacies. So the question was, I caught the magnesium and vitamin D, but could you elaborate on the third dietary supplement I talked about? And I will. And the nice thing, I actually have a slide on here. So the third one, and we have, if you're stopping by to pick something up, ask for the handout. What do I eat? And the third one is fish oil, and fish oil may seem simple, and maybe your doctor told you, hey, it's not good for cardiovascular health, but there is a lot of data on increasing the omega-3 index, and specifically when we're talking about fish oil, we're talking about eicosapentaenoic acid and docosahexaenoic acid. So these two specific omega-3s are things almost everybody is missing from the diet, and the reason is very few people are eating the fatty fish, sardines, mackerel, anchovy, salmon, and herring. And even worse, if you're eating salmon, a lot of the salmon you'll get at restaurants and things is farm raised, which is better to eat that than some of the other things, but it doesn't have the concentrations of EPA and DHA that a wild caught salmon would have. So when I go through, and again, I do individual consultations where I'll have people send me food diaries for 2 weeks. When I go through their food diaries, very few people are getting 3 to 5 servings of these fatty fish a week. So without even doing a blood test, I almost know that they're going to have a low omega-3 index, and a low omega-3 index correlates with cardiovascular disease, with inflammation. So instead of jumping to a statin, my preference is getting omega-3s up from the diet, and then leveraging a high quality supplement. So Orthomolecular is a company in Wisconsin that is a professional company. So you're only going to see these at healthcare professionals. So you might see them at, so obviously I'm a doctor of pharmacy, so I'll sell them. Nutritionists can sell them, and there's some good chiropractors in town that actually sell this too. So so fish oil does not equal fish oil. So another good company that eye doctors will sell is Nordic Naturals. But just making sure if you're taking a fish oil, look on the label. EPA and DHA is what you want. Kind of as a maintenance dose, somewhere between 1,000 and 2,000 milligrams. So if someone's not having symptoms, just wants to say improve their health, I'll have them usually take 2 capsules of the Ortho Omega a day. But I just want to point this out that for dietary supplements and CBD, that you can't just compare apples to apples. So even though these are both 1 gram of quote unquote fish oil, the EPA and DHA is varied by 3-fold. So this brand here has 180 milligrams of EPA, 120 milligrams of DHA. So 300 milligrams total in 1 capsule versus 820. So just to know, if your doctor tells you to take 1 gram of fish oil, they usually don't know these things. And they're what they're actually talking about is 1 gram. If you look at the studies of EPA and DHA, and this is something we do offer in our pharmacies as well. So something that I hope becomes more standard of practice. The omega-3 blood test is from Omega Quant. You can order it straight from them online. I think it's about $50, and we offer these kits in the pharmacy as well. But this will tell you your omega-3 index. So basically, this will tell you how much of that omega-3 acid is getting into the red blood cell membrane. And the more omega-3s, the more flexible the cells are, the better the inflammation is. And if that's fine, I know we don't need to adjust anything. If it's low, I know we need to adjust things up or down. So this is something I do with quite a few of my clients, is the omega-3 index. So the big 3 is vitamin D. Know your vitamin D level, particularly right now as you go into winter. And unless you're on warfarin, always look for vitamin D with vitamin K2. So we at the pharmacy, we have a product that our pharmacists actually make, and we do the third-party testing ourselves, called Evolve Wellness. We do have a vitamin D K2. There's other good brands out there as well. So vitamin D with some vitamin K2. Magnesium. So magnesium is found in the center of a chlorophyll molecule. Almost nobody is getting enough green leafy vegetables. So magnesium glycinate particularly. So if you have magnesium at home, look at your bottle. It says magnesium oxide. You're probably not absorbing it. Magnesium glycinate is pretty inexpensive. It's an easy thing to get up. And it's something that most people are missing. Then the third one is the EPA and DHA. And again, shelves in the pharmacy, there's a lot of other products out there too, but they're very targeted. So some people have on a lot of different products. Other people just have on a few, but it varies from person to person. Good question. So the question was, how much does it cost? Does insurance pay? So the cost for CBD oil is going to vary a ton from company to company. As you guys saw in one of my previous slides, the prescription product, Epidiolex, insurance will pay for it if you fit certain criteria, and it's very narrow criteria, so less than 1% of the population. So if you have Dravet syndrome or LGS, that are specific seizure disorders. So if you fit into that bucket, it's something definitely talk to your doctor about, because then the insurance will pay for it. All of the over-the-counter products, insurance, they do not pay for it, just like unfortunately insurance usually doesn't pay for a multivitamin. They do not pay for these products. So I can tell you guys a dose range. Usually you should expect to pay for about 500 milligrams. You should expect to pay somewhere between, so if the bottle says 500 on the front, somewhere between $80 and $100 for that. So it's not cheap. You do buy it over the counter. That lasts people anywhere from 2 weeks to 6 months, depending on the dose that you're taking. But if it's any cheaper than that, there's probably steps being cut. And I've visited a few different of these manufacturing plants, and I've seen firsthand the difference between companies who do it well and don't do it well. So unfortunately right now, getting it from a professional company is the best way to go. And again, expensive doesn't always mean better, but so answer the first question, it is covered by insurance in certain circumstances, very few circumstances, and that's the Epidiolex, the CBD isolate, but the over-the-counter full spectrum are not covered by insurance. It's over-the-counter purchase. Perfect. All right. So that I appreciate all the questions. I miss seeing everybody's faces. I do want to make a couple other quick notes. I think I've got 9 minutes before I go. So the labels are sometimes confusing to look at. So again, both of these are fine products. But if we look at the label, if what we want to look at when I'm saying take 10 milligrams, I'm talking about the cannabinoids or CBD. So for this product here, the Ananda, if you look on the supplement facts box, 1 dropper full or 1 milliliter has 20 milligrams of CBD. So if I want someone to start with 10 milligrams, you would need to take a half of a milliliter. And the nice thing, another reason we use this company is because they're a professional company, their droppers are graduated, so you can see exactly where a half of a milliliter is. And then so for this product, you might think it's this 28 milligrams, but you actually want to look at this. This is what we do. Just like with fish oil, we look at EPA and DHA. For hemp extracts, you want to look at the phytocannabinoids. And majority of this is going to be CBD, so we just assume a 1-to-1 of CBD here. But so if we did a half a milliliter of this, you're going to get slightly less than 10 milligrams. So what is that? 8.5 milligrams. But just know the dosing will vary depending on the product and the concentration. So just make sure you're reading the supplement facts box to be sure that you're getting the dose that your practitioner intended you to get. And then I do want to make a note, certificate of analysis. Every company should have a certificate of analysis, but just because they have one, quite frankly, doesn't mean anything. There's been companies we've approached that say, oh yeah, we do third-party testing, and then they give us a certificate from a batch from 2 years ago. So it's something that, and then worse, we've seen people forge these. So just because, so certificate analysis is important, but again, do you trust the company? Do you trust the person that you're working with? Because that is the most important thing. And there's a lot of not so great things going on among companies. But if you guys want to learn more about this, feel free to, I think we're going to upload this to our YouTube channel, but projectcbd.com is a great site. I have nothing to do with it, but it's a great site where they synthesize some of the literature. So check them out. And then I think the overall question is CBD right for you? And I'd say discuss with an open-minded doctor of pharmacy. So feel free to stop in any hometown pharmacy. Be happy to help, or wherever your pharmacist is at, as long as they have this on their radar. Start the conversation there, and then we'll see. And I think an important thing, my bias, I always tell my wife this as a practitioner, hey, they should choose us like they choose you, but choose your pharmacist carefully, choose your physician. We're very accessible and happy to help. And I do offer personalized wellness consultations right now because we can't bill insurance, and with the current situation, it's appointment only. I'm only doing a few in person, but it's $200 for initial consultation, $100 for a follow-up. And again, we really get into the weeds and do some lab testing, and we do some specific nutrient consultations. If you want more information on that, send me an email or give me a call at the store. And also check us out on Facebook. Every question that I've been getting probably this past 8 months has been about the immune system. I did a video in March with the YMCA, similar to this format, where we talked about the immune system, specifically looking at dietary supplements and nutrients, and a lot of that still rings true today. And the things that we talked about with optimizing vitamin D, omega-3s, and magnesium too. But just know lifestyle is a place to start, and there is some data coming out on vitamin D deficiency. So getting vitamin D up, taking some zinc, maybe some vitamin C. There's different things you can do, but the big thing is lifestyle and making sure that we are keeping our distance right now, wearing our masks, and getting your flu shot in a safe atmosphere. But with that, I want to be respectful of your guys' time. Unless there is more questions, I will close there. I do want to actually, sorry, I'm going to say two more things. I have two presentations coming up, one in November, one in December. December is going to be specifically focused on immune health and looking at lifestyle, and November is on falls reduction, looking at medications. So if you guys are interested in them, go to our Facebook page. I forget when the dates are. We'll post the dates there, but Facebook page, Sawyer Street Hometown Pharmacy, and happy to help. We got a lot of videos there too. So hope you guys have a good day. Oh, one more question. The question was, is CBD effective when rubbed on skin? And that is a very good question. So the things that it can be helpful for on skin. So if someone has, say, dermatitis or redness or irritation, raised skin, it has been helpful rubbed directly on the skin for that, because it's going to obviously penetrate the that layer of skin. I like to use more than that is chaga. So chaga is a specific mushroom that we'll use for people who have eczema, dermatitis, and things. So topically rubbed on skin. But then I think probably where this question is getting is, does it penetrate deeper than the skin into the muscle, into the joint? And that's where it's kind of variable. If it does, you do know that if you're using a topical, that some of it does get into the bloodstream, so it does circulate a little bit throughout the body. But whether it gets into the joint, the research that I've seen is variable. But I like to use topical products for people who have like a specific. So for me, I use the roll around my neck for arthritis, inflammation. There are studies that they used topical CBD on joints, and it helped with pain. Whether or not it got absorbed to the joint or the muscle, I don't think they looked at that, but it does seem to get absorbed or go into the muscle a little bit. Good question. So if you don't have Facebook, we do have a YouTube channel, and like you, I'm happy you don't have Facebook. That's good. I'm trying to eliminate as much of my social media as possible, but I will talk to I am a terrible marketing person, so I'll talk to my marketing department. But I know if you just have access to the internet like you do since you're watching this, and go to YouTube and type in Hometown Pharmacy, I think our video, we have a YouTube channel on there. So my plan is to upload this to that, and this COVID-19 immune support strategy should be on that as well. So if you go to YouTube, type in Hometown Pharmacy, and then maybe my name as well, just so that you can get to our channel. But that's a good question. I'm glad you don't have Facebook, because I don't have Instagram or Twitter, or those things. Facebook takes enough of my time. It does? Okay. Awesome. So Julie just told me that if it's Hometown Pharmacy and then JJ Allen, then the videos pop up. Okay. So if you go to YouTube, type in Hometown Pharmacy and then JJ Allen, or I'm sure you could probably just type this direct thing, COVID-19 Immune Support Strategies Live with Dr. JJ Allen. But to get to, and then you should be able to see our other videos too. So Hometown Pharmacy, and then type my name, JJ Allen. There'd be videos on there. There are videos on Facebook that aren't on YouTube, but most of the longer format videos are on YouTube. Thank you. Good. All right. Well, with that, thank you. And I think just parting thoughts. Hope you guys enjoy the day. And I know we're all, my preference would be to see all of you guys here, but I'm glad that we're able to interact virtually. But again, questions, send me an email, give me a call, and make sure you take some time to get outside and talk to your family whether it's over the phone or whatever it is. And I'll leave with one quote. My favorite philosopher, Marcus Aurelius, always talks about, or one of his famous quotes is, "The impediment to action advances action. The obstacle is the way." So I hope we're all taking this time. I need to remind myself to do this as an opportunity to find silver linings within this and help as many people as possible. But you guys take care.